Nursing students who already are registered nurses have the option to obtain their bachelor's in nursing through the RN-to-BSN program, which is coordinated by Dr. Linda Thomas. We met with her to inquire what her job entails. Dr. Thomas teaches 3 nursing courses online to students who are already licensed and have an associate's degree in nursing. The first course teaches students how to get started in the nursing program. The second course teaches political views in the field. And the third course focuses on leadership and management. These courses, Dr. Thomas said, help students dig deeper into the world of nursing.
What I'm doing is I'm adding some fringe. I'm adding some icing to the cake. I'm providing information on becoming a responsible professional, becoming a leader, developing themselves in the policies and issues that are related to professional nursing today.
The frequency of students taking online courses has risen tremendously in recent years, but how are online courses in nursing beneficial to the students as opposed to a physical classroom setting?
It's very common for a student to be in a classroom and be very passive, a very passive learner. They can sit there, they can listen to the lecture, they can practice on their own, they have to demonstrate eventually in a in-class setting. In online education, there are so many built-in options that the students and faculty have to discussion boards where they actually have to analyze the content they were supposed to read. The ability to respond to another person's information and their postings. They are required to present. So there are a lot of options that get the learner to actually moving through the course and actually participating. And that's a big piece, I think, about online education.
Nursing is a very hands-on discipline, but Dr. Thomas says that the online courses compensate for that by making students analyze their performance and hone their critical thinking skills. When we asked Dr. Thomas whether it was easier or harder for students of different ages to take online courses, she told us that she makes the students collaborate with each other to make sure everyone is technologically on the same page.
I have a lot of older students who've never done a PowerPoint, haven't the vaguest idea how to do that. Posting to YouTube, they're just kind of lost, and they will have a lot of questions about that. And the younger student maybe has not submitted documents to Blackboard or developed a paper in such a way that, you know, that's totally different for them. Now, what's neat sometimes is if you've got a very savvy student in technology or several savvy students, you kind of group them with some non-savvy students so that they're teaching them as well and they're learning from each other. So it works well in the program.
Finally, Dr. Thomas lists the most rewarding aspects of her line of work in the nursing world.
I think the flexibility is a nice piece because I know that I'm not always in the classroom or I'm not always lecturing every single day. I may be working with a variety of students doing a variety of projects and kind of being the consultant for them. I think also I'm more hands-on with the students. You could be a lecturer and lecturing 2 hours or 4 hours a week and not have them in clinical. And you would not have that interchange with them as often. I think there's more of an interchange with the students in the online.